got a large room, and we ended up with, I think we have 7 or 8 sewing machines that staff brought in, which we clean daily, and we started a production line.
The end result are these awesome masks, which Deb is modeling.
Normally, nurses Lisa Hattlestead and Deborah Hedrick run the operating room at Lutheran Medical Center in Wheat Ridge. Now, they are helping create masks from a wrapping material normally used to sterilize their tools. These masks are not for COVID-19 patients. Instead, they are backup for more general use masks.
The intent is for these to be used as procedure masks. So if a provider needed to just enter a patient room and protect themselves, this would be a minimal amount of protection without having to use our N95s, which we want to preserve for those positive patients.
The CDC calls homemade masks a last resort, and many hospitals won't accept ones made by the well-intentioned members of the public.
There was a study that looked at comparing surgical masks versus homemade masks, and what they found that the risk of homemade masks was significantly higher at transmitting infection.
Since Lutheran controls the production of their homemade masks, they also control the cleanliness.
We appreciate people in the community wanting to help out at home, but this way we've got specific people doing each, and it's like a production line, each phase of it. So we are able to produce 400 a day.
Lutheran is working with other hospitals in the SCL Health system to make these masks right now. Now, the nurses tell me they haven't had to use them. They're simply creating some backup at this point. Banner Health, which has 5 hospitals in Colorado, tells us they are also working on making masks like these. Jennifer Meckles, 9 News.